Welcome, everyone. I'm Dr. Jessica Seaman, Assistant Dean for Faculty Development in Creighton School of Medicine. Thank you for joining us for our second in the four-part series, Advancing Inclusion and Belonging in Health Sciences Education. Today's session is Black Men as Healthcare Providers, presented by Dr. Vic Waters and Dr. Obi Egbo. Just a few housekeeping items before we introduce our speakers. This session is being recorded and you will have access to the recording and slide presentation for future reference. We invite you to ask live questions or submit them in the chat, and we'll get to as many as we can by the end of the session. We do ask that you remain muted with video off unless you are asking a live question, just to assist with the recording. Also, this session is eligible for CE credit, and you'll receive the website and activity code before we conclude. There is a short survey associated with the continuing education. It's 4 questions, and we do thank you in advance for providing feedback as we continue to bring you diverse and robust programming here at Creighton. Dr. Ron Johnson, Senior Associate Dean for the Office of Diversity, Inclusion, and Belonging in the Creighton School of Medicine, will now introduce our speakers. Dr. Johnson.
Thank you, Dr. Seaman. We're very fortunate to have 2 very talented and experts in this area of looking at the topic of Black men as healthcare providers. I want to try to summarize some of the credentials of these 2 fine individuals. First, Dr. Vic Waters. Dr. Waters is the Chief Medical Officer of Dignity Health St. Joseph Hospital and Medical Center and Westgate Medical Center. He's a physician with over 35 years of clinical experience in emergency and internal medicine and over 20 years of experience in administrative leadership. Dr. Waters leads 4 law docs in which he founded to provide online mitigation courses and organize legal seminars of health providers. He is a CMO of HandGenX Solutions, a startup digital healthcare company with an ultrasound-based monitoring system designed to improve the compliance with hand hygiene. He's also a national spokesman for the American Lung Association. Dr. Waters earned his undergraduate degree from Brown University, is a graduate of Temple University School of Medicine, and obtained a Juris Doctorate degree from Rutgers University School of Law. He is passionate about the issues of healthcare inequities and is a member of the Common Spirit National Diversity and Inclusion Council. Dr. Obi Egbo is a president and founder of the Zion Medical Group. He's the Associate Chief Medical Officer for St. Joseph Westgate Medical Center. He's also an Associate Professor of Clinical Medicine at Creighton University School of Medicine in Phoenix. He is a founding chair of the Arizona chapter of the Association of Nigerian Physicians in the Americas, or ANPA, and continues to serve on the board of the clinical leadership teams of Elite Healthcare African Cultural Heritage. Dr. Egbo is a graduate of the University of Nigeria College of Medicine, obtaining combined medicine pediatrics residency training from the University of Miami-Jackson Memorial Hospital. He has extensive international medical experience from Nigeria, Trinidad, Tobago, and Australia. And is also a fellow of the Society of Hospital Medicine, American Academy of Pediatrics, and a graduate of the UCSF Hospitalist Leadership Program. I'll turn the program over to Dr. Egbo. Thank you.
Thank you, ladies and gentlemen. Thank you for this awesome opportunity. In many ways, I feel not qualified to be the one in this seat today, but by divine appointment, I'm the one here. I want to thank God for my journey so far. Thank you, Dr. Johnson, for that wonderful introduction. Thank you, Dr. Seaman and your team for the excellent job you do. I'm honored to be on this panel today with Dr. Waters, one of my mentors. I sure appreciate the opportunity. I'm so thankful to God who have led me through this journey so far. And this is a topic that could take us months and years to discuss, but you're going to hear some stories, hopefully, that you can take home with you. Being healthcare providers, we usually start by, sort of making a diagnosis. So the next 10 minutes, I'll share a few slides with you that will remind us or hopefully inform us of some of the challenges we face as Black men in the healthcare industry. Next slide. We're about depending on the research you look at, 10 to 13% of the population, African Americans, and only 5%, and I took the higher numbers, some will represent us as 4%, are medical doctors who are Black. Next slide. And furthermore, in demographics, if you go to nurse.com, there's a research that was done in 2021 where over 2,500 qualified nurses completed the survey. It really speaks for itself. As you can see there, the red will be the Black or African American RNs, LPNs, and also nurse practitioners. You can see the obvious discrepancy and amplified variance in those areas and demographics. Next slide. If you go to the dental world, this is dated about 2016, but hasn't changed much. You can see how that's even more impactful. The comment I wanted to highlight was that the underrepresentation of Black dentists is extraordinary, and the Black dentists that are in practice are shouldering a disproportionate share of dental care for minority and underserved communities. Next slide. In terms of compensation, and this is so important because that's part of a challenge we have, you really can't go to school without money or access to money. And this study from 2018 shows clearly that Black men in general are underpaid. You can see those numbers for yourself. They're paid $0.71 or 71 cents of every dollar paid to our white counterparts, and the Black women face even worse than what we do. They're paid about 63 cents to every dollar paid. And as far as compensation goes, you can see this is really trying to point out, as far as nurses, you can see the average work hours there, the pay is about the same, but clearly nurses who identify as Black or African American reported the lowest level of satisfaction with their current salary and working more hours per week than other racial or ethnic groups. Next slide. And as far as leadership goes, this is just a snapshot. By no means is this 100% what we see across the board, but it's important to note that the Leverage Network did a study in 2021 where about 623 board members at 41 of the largest healthcare organizations in the country, they had a survey done. And you can see the average distribution right there. Amongst men, 11% were Black, and other minorities were 2%. But among those CEOs, Black men held just 8.5% of the top jobs, and women only 4%. And it's worthy of note that there was not a single Black female healthcare CEO in that study group. Underline the study group. Next slide. And one would assume that over the span of 120 years in the United States, we've seen a meaningful increase in African-American doctors, but that's not what we see. This UCLA study is dated nearly 8 to 10 years ago, but it still speaks to what we're going to discuss a little bit more today. The pay discrimination is there, the unequal access to career opportunities. The proportion of Black physicians increased by only 4%. And percentage of Black males becoming doctors since 1940 has not changed. And income between Caucasian and Black male doctors in 1960 was about $68,000, and in 2018, it's $50,000. Next slide. And you can see too the history here, the African-American population, Black doctors, and then Black doctors male to female ratio. So if you go from left to right from the top, in 1900, it was about 11.6% African Americans. You moved to 1940, 9.7%. And in 2018, roughly about 12.8%. And then you go down there and you see the percentages, 1.3%, 2.8%, and 5.4%, roughly US doctors. And you look at the Black male to female ratio, and you see that discrepancy as well and representation. Next slide. Between 1940 and 2018, essentially the slide I just showed you, proportion of Black male doctors stayed pretty much the same. And the mantra for us is that if medical leadership is serious about making the physician workforce more representative of the general population, much more effective policies need to be conceptualized and implemented. When we hang out in the common room, some of the things you hear us say is that a majority of us are really in the jailhouses for things we shouldn't be in. For a population that really is already at a disadvantage, we need policies in place to give Black folks opportunities to excel in the area of medical care. Next slide. These findings demonstrate how slow progress has been. Underline the word progress. There has been progress, and how far and fast we have to go. Far and fast. If we care about the diversity of the physician workforce and the health benefits such diversity brings to patients, particularly minority patients, we have stories upon stories we're going to have time to talk about later on about the importance of this and making sure that we give the ones that are coming after us and our contemporaries as well reason to continue to excel. Next slide. The perspective, before I jump real quick into my story, will be that the iceberg illusion is a lot of us will become docs. What people really see is this illusion is a very popular slide. I'm sure most of you have seen this. What people see is the success we've had. What they don't know is the persistence, the failures we've had, the sacrifices we had to make, the disappointments, the discipline, the hard work, the dedication. This is what they don't see. Nothing is handed over to any of us. And I just wanted to put that in perspective, that it's not a hand-me-down situation for us. It surely gives us opportunity to make sure that we, like I say, continue to excel and build for the next generation. Next slide. All right, so this is an exciting slide, and this is where I'm going to land before I hand over to my big brother and mentor for the home run. To your left is my parents. My mom rose to be the state director of health in Nigeria. My dad was a parent to his quote unquote throne in the village in Nigeria, but he digressed and became the first graduate in the entire city. And that trajectory changed everything for us. So I really want to give kudos to him. If you go to the bottom, the story really starts, this is in 2004, during my residency days at University of Miami. Those are my first 4 kids. We have a 5th one that you're going to hear about in a second. You start early. These are these kids wearing stethoscope around their neck and lab coats. This is us building the dream and saying you can. At the bottom there, my first and my third son, both are currently 2nd year medical school. The good part about this is that if you look to the top, the University of Arizona, any Wildcats in the house, you can chat that up. They both were physiology and biology major. They were the face of U of A track and field. And twin number 1 is in medical school. Twin number 2 is doing his MBA and hopefully will be going to Marquette for dentistry. And if you look to your right, that's my daughter, 22-year-old. She graduated from Pepperdine. She ran track, D1 athlete like the brothers. And she's taking her MCAT in 2 months, and we're hoping she'll go to med school. And my third son, our third son, Joshua, did biology major. He graduated in 3 years. He played football, D1 football, University of Montana. Great fans, you can chat that up too. Joshua today is in medical school. He's also a TikTok star. He has over 2 million followers. And if you look to your right, that's my son, Benjamin. He plays basketball and he's a state champ, Perry High School Pumas. You can chat that up too. And he's been looked at by a bunch of D1 schools. He also hopes to be a doctor, and he's at 4.3 GPA. And if you go to the bottom there, that's us at the graduation of my son, Joshua, in Montana after 3 years. And of course, in the middle there is the powerhouse of the family. My wife is a pediatrician. She's board certified. She's a board member of multiple great organizations. And we really believe that God has put us in a position to model what this ought to look like. We work hard every day. Everything you saw on that illusion board is what we do on a daily basis. We've been graced with this wonderful family. And we will continue to model that, because people hear and listen to what you have to say, but they'll follow what you do. And I can't but help give glory to God, because there's absolutely no way that we could have been able to get to where we are or where we're headed to. That last slide they attached is to show you during COVID, the importance of making sure that we have more and more representation of African communities in the healthcare industry. I had the opportunity to speak in multiple areas. Matter of fact, a lot of people who would not ordinarily have taken the vaccine ended up taking the vaccine through the voice of people like me, my wife, and the rest of the African-American medics who spoke up and encouraged people to do that. So that impact is really powerful. And I just want to, again, say thank you. There's not enough time to go through everything, but I just want to say how grateful I am to Creighton University for your inclusion ideas. This is something that most people will absolutely talk about, but never do something about. You are leading the charge on giving us this opportunity. I'm grateful. Thank you.
Thank you, Dr. Egbo. Dr. Waters.
Thank you. Thank you, Ron. Dr. Egbo, you know how I feel about you. I want to let everybody know that this is a very special brother here. He has demonstrated some amazing leadership and amazing leadership potential. I also want you to be aware that Black men represent just 2%, a little bit over 2% of medical schools, Black men. And that number hasn't changed since 1978. Now, I'm going to date myself. I've been doing this for about 4 decades, and it's unbelievable. And there's many reasons, and not time to discuss this right now, but there's many, and certainly when we get into question answers, we can have that open dialogue. But it hasn't changed. Enrollment of Black men into medical schools has not changed in almost 4 decades. Just think about that for a second. The other point is, for there to be physician leaders in healthcare, particularly Black men, we need a channel of Black men going to med school and becoming physicians and practicing and showing their game, and then so they can be in leadership roles. So we have a long way. There's a huge gap in our future, especially as our healthcare is more complex than ever, more diverse than ever. We have a community of color that is in great need for African American men in leadership. I can tell you now, if it wasn't for my mentor who went to Howard many years ago, my mentor who was my family doctor when I was a child, I wouldn't be sitting in this seat right now. There are many stories and fork roads of how I got into this, but I can tell you, I was actually, as a young child, when I saw scary movies or blood, I wasn't very, I didn't like the sight of blood. And I remember telling that to my doctor, and he said, "Don't worry about it, you'll get used to it." And because of those few words, it kept me on track to become a doctor, not only a doctor, but a trauma yard doctor. I saw plenty of blood in my lifetime, and I realized that he was absolutely right. I'm forever indebted to my mentors, and that's why I'll continue to mentor physicians such as Dr. Egbo and others. So let me share my slide, and it starts with, you see, Dr. Egbo at Doctor's Day, and we have Dr. Franklin also. He's a pediatric cardiologist at Phoenix Children's. But let me start with my story. You might notice, I think I was about 5 years old, I have red hair. Just keep that in mind. But my story is I grew up in Queens, New York, grew up in an all predominantly Black community, basically middle class to low income. Jamaica, Queens, if you want to look that up in the map. And I went to high school at a public high school. You can see a whole lot more hair, and it wasn't red, even though this is a black and white screen. I did my fair share of sports, but when I went to high school, it was one of the most divisive schools in the city in the 70s. I went in the early 70s, believe it or not. And it was at a time where I was being bused to a predominantly white school in Queens at the time, and I was in a Black neighborhood. and the neighborhood didn't particularly like that. So there were definite tensions and security and police often as we were bussed out of school. That's the memory I have, and I want to share these stories because they've impacted me. This is a picture of my mother. I went to Brown, and it's a picture of my mother my first year as a student in my first day going to campus. And this was one of the pictures that were sent to me in my early days as a resident. I had the little mustache going, but I don't have that no more. But that's, again, almost 40 years ago in ER. And of course, more recently, I've started my role here at St. Joe's and Westgate. I'm proud to be part of that. And I do a lot of teaching and seminars. Just to plug in, I'm doing a seminar actually in a few weeks. And Dr. Egbo is one of our featured speakers. I do a lot of medical legal conferences, including with primary care topics. So this a plug in, and those of you who are on, students are free if you register. And I know there's been send outs for that, for everybody to participate. So please attend. It's going to be very insightful. We've got Dr. Harder, who's going to talk about well-being, physician burnout. Dr. Lee talking about palliative care. John Shufold, who owns the ER Legacy, our ER company that's affiliated with St. Joe's. He is a physician attorney himself. A lot of incredible discussions here. So I gave you a little brief of the formal story. Let's dig in a little bit more. These are my parents. It's my father and it's my mother. My father was in an all segregated World War II army. He fought 3 tours of duties. He saw racism in the day of you can only drink at the black fountain. He also participated as in the all segregated in the African baseball league back in the day when black players weren't allowed to be in the majors. So he was quite an athlete in his day, but never had the opportunity. And in his later years, at least when I grew up, he was a mailman. My mother worked for a company called a graphic arts company. I'll talk a little bit more about her. A very special woman. She started a company, not own it, but started a company in Manhattan, graphic arts, and eventually rose to become president, but did not in any way make presidential kind of cash. She was a gifted, skilled person. Both of them never attended college. So I'm the first generation to go to college. I grew up in a rather negative environment. I mean, when I go back, it wasn't very positive, not much support to go to med school, to do anything with your life. And unfortunately, my parents had no idea about college or things. So, but even still, there was a lot of support through other channels and many other channels to help steer me in the direction I've gone through. As I mentioned, my mother was a businesswoman in the 50s. It was unheard of. Actually, when I went to college, I wrote to Ebony, and they came out and interviewed her. She was very quiet, unassuming, brilliant. And there's a lot I've learned about her leadership skills. A lot I've learned as she suffered overt racism. Overt racism, let me repeat that. This is in the 50s for a Black woman to be in an executive role. She was way ahead of her time. But she had to fight those battles, those corporate battles, as well as fight insecurities of a parent that is making more money than her spouse. So those are the kind of battles I've seen her struggle and rise to the occasion. And as a result of that, I've learned a tremendous amount I learned people skills, leadership skills through her, and just being and growing up in the streets where there's a different sense of survival that you must have. So why am I sharing this? Is because I come to find out, to make a long story short, that I was adopted. Both my parents passed away in the early 90s, and they buried that secret with them. And lo and behold, a relative at my parents' grave funeral said, "By the way, boy, we got to tell you something. They're not your parents. And you would think, as you remember, go back, that I had red hair when I was born. You would think I would know something, but my parents buried this with them. I came from the generation, and I'm again dating myself, being a child of the 50s. They never talked about it, never wanted to talk about it. My father never talked about World War II and the things that he's been through and the sufferings he's been through. So as a result, that's what I had to accept. It was all meant in good intention. So I had hired a private investigator, and I found my mother. This is a picture of my birth mother. She's redheaded, by the way, and she's Russian. So I'm actually first generation Russian. My father, this is a picture of my father, number 12, athletic, did football, did basketball. He was quite athletic gentleman. And when they were 19 and 20, they had me. And all honesty, and be frank to you, part of the story is that my mother was date raped by this person. But be as it may, I'm here, and I've learned to appreciate, life. Now, my birth father, was in a number of relationships, so he's had a number of children, and we call it Papa was a Rolling Stone. And so he was a singer, he was athletic, but then he went on to another route, and that was that despite his being so smart, he started robbing banks, and he was imprisoned, and then he was murdered. So I've lost a parent through being murdered. And it's a hard fact to go, but still things rise. And we as, me as a person and understanding my history, we rise to the occasion. So in all that, I found all my half siblings here. About 8 years ago, an investigator found all my half sisters. So I have from my father's side, half sisters and a half brother. So in the front is my half brother, and I have 3 sisters. One in Kansas, actually all of them are in Kansas right now. One's an attorney, the other is an IT, and the other is a caregiver and a minister. But I have 3 sisters and 1 brother now from being an only child, for God's sake. And then beside me is my wife, and beside my sisters is my son, little Vic. So I wanted to share that story. People keep saying I need to write a book, but my story ain't over. And 4 decades, you have a quiet perspective. So I'm just going to share some insights here that both from being a physician and an attorney and a clinician that I want you to hear and understand. Here are some basic facts. Systemic racism still exists in healthcare. The CDC says healthcare inequity is a #1 problem, and it by every and all means is. And if there isn't more attention to the sensitivity of this, no differently than our sensitivity in the criminal system, it's a significant issue in our healthcare system. And a lot of it is derived from where we come from, our backgrounds, how we perceive people. Much of that pours right into how we can and will care for people that we don't know or are not comfortable with. But there has to be a reach out, not just for more African-American physicians, but for more people to be aware and understand and be more empathetic of the suffering and the history that the Black community and community of color, the Latino community, the Native American community, what pains they have that have created so much distrust with the medical community. I can tell you tons of stories, reasons of distrust within my own family. And I already mentioned leadership in academia and in Black men is lacking. And as an attorney, I'm going to say that licensing, civil liability, as I mentioned, and licensing boards, there is systemic racism. So why do I say that? If you as a physician, or you become a physician, you're a Black student, and you become a physician, you made it, and you're an attending, and many people, most, by the time they're 40 years old, and that may seem like a long ways to you, but it's not, you may end up getting your first lawsuit. Well, if you fight it and go to trial, you have to understand that there may be some unconscious biases, a presumption of guilt that should not be there, that may be against you. And you may end up losing that case, not because of the warrant, not because the case that you deserve to lose the case, but maybe because of the unconscious bias against you and some of the presumptions against you. So these are the kind of, and even licensing boards, the same. Licensing boards can have even more of an impact than a malpractice claim. But I just wanted to touch on that because it's very, very, very important to understand. And I hope we get some questions. So here are some tips I have. And then we're all going to talk about this because I think we got plenty of time. And this is my last slide. I want you or anyone to be comfortable with who they are. Don't be anything more than who you are. I know when I first became a doctor 4 decades ago, I was trying to be something I wasn't. I was trying to be, honestly, a Doogie Howser, or I'm going to say this in all honesty, a white physician. I'm going to talk white. I'm going to act professional. And I lost something of myself in doing that. I lost connectivity with my own community or my own personality or who I am as a Black man. Whoever you are, that needs to come out because that creates the engagement between you and the patient. They need to see true realness as a physician, as who you are. If they see this blank professional look, they're not going to trust you. All that professional look that you show is nothing but a wall between you and the patient, and you and your staff, and you and the nurses. Be who you are, and just keep that in mind. Bias moments, as a Black physician, it's very easy to call or label something bias, or that's racist, or that person's racist. It's very tempting, it's very easy. And the way we may react to that is, have a really hard feelings toward that person or people. And I'm just cautioning that be careful of labeling things as racially motivated, or this person is. It may look like it may even taste like it, but it may not be. So be careful of identifying things like that, because we get into this moment of bitterness or anger, resentment, that may not be actually true. I'm going to say this, it's very hard to know a person's heart. Very hard to know people on this call, your heart up against, for, or whatever your conscious biases are or may be. So, it's hard to judge that person unless they're going to call you out something. And I've been called the N-word. Actually, for me being multicultural, I said, well, thank you. You finally recognize who I am, because, most people think I'm Spanish, Latino, Indian, you name it. Broaden your network. And I've said this to my family and mentors, always broaden your network. Get outside your comfort zone. Be resilient. Something about this business is hard. Dr. Egbo and I, we've come a long ways. We've come through a lot of blood, sweat, and tears. He has a wonderful story that he shared with you, but it's been struggles. I can guarantee you that it's been struggles, and it certainly has been struggles with me. But I can tell you, the resiliency that we've learned from the environment we came from keeps us going. The family, the base of our family and friends. I reach out to friends that have known me since I was a kid from the streets. They know the real Vic. And then be an advocate, because where we are, we don't take for granted for where we are. So we have to be an advocate for our communities, for our nurses, for our staff, even for our friends. That advocacy position is what I've been taught in law school. And it's a strong way to really be more engaging and even more, it's a powerful way to lead. It's a powerful way to help people in ways that you may not even thought of when you're thinking more about other people than yourself. So I'm going to end it that way. Thank you for hearing me out. And I'm going to open it to Jessica. Thank you, Dr. Seaman, for including me in this, of course. And I hope it wasn't too much TMI, but that's my story. I'm sticking to it.
Thank
We
you.
love hearing your story, and Renuga is going to now take questions. So if you would like to unmute yourself, then you can do that, and she will facilitate the chat as well.
Yeah, Dr. Ronson will facilitate as well. Thank you, Dr. Waters and Dr.
You're
Egbo.
welcome.
Being so vulnerable and sharing your story was very powerful. There's a question in the chat, Dr. Emily Babak. She says, you mentioned the disparities in physician, nurses, and dentists. I would like to add that my profession, PA, has the same disparities. 70% of the PAs are white, 5% are Black, only 34% are men, and the trend continues. Pretty much the same, a lot of the same trends in healthcare. I would love to open up for questions. Please put your questions in the chat, or you could unmute yourself and ask the panelists questions. Father Fitzgerald, do you have a question?
Thank you, Renuga, and thanks again. Wonderful presentations and very powerful stories. So, yeah, it's been my experience too that even on the federal level, so at the NIH, for instance, they've had programs where they've been trying to address these imbalances in representation, and yet there hasn't seemed to have been much progress. What recommendations, sort of specifically do you have for groups like the federal government and others that have a great deal of impact and influence on sort of fostering opportunities in these communities?
Good, Dr. Egbo, you want to go?
Okay. Thank you, Father Fitzgerald, for that awesome question. Well, it's really, in our minds, it's fairly simple. So this may be seen as a grand round, but this is really a big opportunity for the over 100 participants in here to take this. And I assume everybody here is a voter. Get involved and think about policies that actually impact how folks get into medical schools, the opportunities, like I said during my presentation. You really can't go to med school without opportunities. That includes money, that includes things like being able to obtain loans, opening up doors for mentorship, et cetera. So I think at the federal level, we need to start holding our representatives accountable, speaking up, coming out of our closets, especially those of us. And this is important to people like Dr. Waters and I, who we really want to make sure that we're not necessarily just holding back. This opportunity is being provided to us because we will have to tell our story. We will have to say, here's our plight. We will have to be loud and hopefully gain the critical mass and momentum that's needed in our little corners, to make sure that our voices are heard. When you pinch someone, they cry out. Okay, so I think that's important that everybody who is on this call, and I want to put something in here that obviously I was born and raised in Nigeria, but America's adopted me, and that's my adopted nation. But what I've noticed is that as far as that goes, that every time we talk about changes and progress, I want to say that every picture I've seen, every movement, including Victor's story, there's always going to be somebody who's non-Black that's there. There's white people that can't stand this. There's other races that can't stand this because it's really a crime against humanity. And I really think our white brothers and sisters and our non-Black brothers and sisters, we need your help. We need you to say this is wrong, like we've heard so many of you say. Part of which is why we're in this conversation today. Thank you.
I have multiple hands. I'm going to start with Dr. Krista Johnson. Would you like to unmute yourself?
All right. Thank you. Thank you so much. It's so wonderful to meet you, Dr. Waters and Dr. Egbo. Such a tremendous presentation. It's such an honor to learn about your story. I'm an OBGYN at Valleywise Health, and just so inspired by your work. I wanted to put a plug out, and perhaps you both could comment on this. Over my journey, now well over 25 years in medicine, things that really burn at my core is the fact that when you look at the Black community, especially as you've both shared, the woeful underrepresentation of Black physicians in medicine, I feel we also have to dig a little bit deeper and really dig into some of our African American students of color, both Black women and men, because I think for those of us, especially, you know, I'm of Caribbean background, my husband is Nigerian, so I get it, like, you know, there's a huge gap for US born Native African American students of color, both men and women, who are being lost in the gap, because we need to really reckon with the historic legacy of racism in this country that has created major structural barriers that those of us who come from Caribbean and African heritage and background are able to kind of like, still we struggle also, but we have some foundational cultural resiliencies that we are able to kind of rise above the fray in a way that puts us in a category of running that race faster and harder, where I feel as though we're just losing a lot of the African American students who may not have had those supports and infrastructure due to structural racism and bias that are interwoven into society in such a way that we need to be even more intentional as we think about how we can make sure that this group does not get lost. Like when I think about my own classmates throughout undergrad and medical school, among the few of us who were Black in these spaces, most of us were of Caribbean and African heritage and descent and ancestry. And I think we also need to really dig deeper in terms of not just mentorship, but also structural policy changes and influences that make sure we're not continuing to worsen those gaps that are already quite large, but especially for native-born, US-born African Americans in this country who are even further left behind for both Black men and women. So I wonder if you could speak to that. And, you know, I'm a daughter of, you know, being born in this country, but have strong Caribbean and African family roots, that I really see that in my own career trajectory. And I really think, as I think about leadership in these spaces, we need to cultivate greater intentionality so that we don't further widen those gaps for our Black men and women in this country.
Awesome. Awesome. That was beautifully said. And thank you for sharing. You know, we all have a story, right? And whatever that is, it really impacts us and what we see around us. And I see you know, I share clearly the same burden. And with, you know, when I grew up, I didn't have many choices. You know, I was told, boy, you can be a minister, you can be a minister, a lawyer, or a doctor. And I just picked one arbitrarily and said, oh, okay, I think I'll be a doctor. That's how it started, right? That's how it started at 5 or 6. Today, it's a lot different with the internet, with Google and the social media. I mean, an average adolescent is barraged by so many options. And the huge barrier, to be honest, is green, the money. You know, when I grew up, there was what we called a National Health Service Corps scholarship, which paid 100% of your medical school, and then you served in a community of need. That's perfect for me, and that really drove a lot of African Americans into scholarship programs. It was motivating, and but that dried up in the late 80s. I mean, early 80s. So all that to say is, I'm connecting the dots here when we talked about the federal government and more support. I want to talk about the real elephant in the room is, why are we so short? Why are we not even touching our goals? Why are these gaps so large? Money-wise, the culture, just the glamour of being a doctor isn't like it was when you seen, I'm gonna date myself, St. Elsewhere or ER. I don't know if you'll know that. The glamour isn't as much there. The number of years you're in college, even just in general, those of you on the call, you know, you have your friends who didn't go to med school, they're in engineering or in IT and tech or startups. They're making money, they have a house, and then you got to go another 5, 6, 7 years. You got to do fellowships, you want to do research. It's a hard road, right? And you may be called, few are called. But those who are called, they have to take a hard look. Is this worth it? And you pointed it out. There may be people that you have in your classroom that don't even make it. There are so many pre-meds when I went to Brown University that didn't make it. It was hard. And I was one of those. I came from a public school, went to an Ivy League school. I was overwhelmed. I didn't even know what private schools were, or boarding schools were. It was a completely different environment. And as a result, it was shocking. But something in me just persevered. And I'm grateful for that. But there are many that haven't and have not made it through this journey. So I hear you. And I specifically speak to your maternal, OBGYN, maternal care and Black women is a huge issue. And I speak to it all the time, particularly in our OB wards, wards with our staff and our training and our research and our nurses, et cetera. It is a major problem, and it resulting in death. And most of it's because, I want to say this very simply, they don't understand just some foundational things. What is it like to be hemorrhagic shock as a Black woman? Where are the telltale signs that you may not ordinarily see in a white woman that may be harder to detect in a Black woman? Am I right? And those signs may go unrecognized, and those patients may die as a result of misdiagnoses or underestimating the severity of patients, or more importantly, not hearing them. They hear an angry Black woman. See, these are the unconscious biases. I want to speak to these kind of things because this is what matters in the training, everyone's training, and it matters that we are advocates for that training. So I know that didn't answer your question in so many ways, but I'm just trying to bring out some things, take opportunities for people to hear bigger picture. Dr. Egbo, I'd love to hear what you have to say, man.
You're on mute, Dr.
All right. Yeah, thank you so much. Vic, you did a good job of it. Thank you, Dr. I'm trying to read your last name here, Johnson Abakwi. I'll connect with you later, but thank you for being bold to ask those questions. You're absolutely right. So during my intro, you heard that I'm the founding chair for the Association of Nigerian Physicians in the Americas. We have a potential to be 4,000 doctors. And so you're right, our story is similar, but a lot different. I grew up hearing that I was the best thing that happened since sliced bread. My first 2 decades, I lived in Nigeria. I grew up as a prince. I grew up, it didn't matter if you had food to eat or not. There was a certain level of self-pride that was, that you had as a Black person. Nigeria, for the record, is the biggest pool of Black intellects in the whole world. The census says we're 120 million. I know that they didn't count everybody. In my books, we're over 200 million of us. And so the reason I point that out is that our journey then starts when we get to the United States. So we face a whole different battle when we have to come in. And again, time will not permit me to tell you what these biases are and what these challenges are. And some of our best doctors are not with a stethoscope around their necks, okay? And that's what we got to make sure we open the doors to, because America, when I swore that oath, it talked about it being the land of the free and the home of the brave. But there's so many free and brave that are sitting on the sidelines and not being given opportunities. I can tell you at least 1,000 doctors that I know who are Black males and females who will do an amazing job coming in, but those barriers, time will not permit us today to discuss, but this is what we want our audience to understand, that those barriers exist and that at any level you're in, if you could help open those doors. A simple example, if you're a Nigerian doctor, Ghanaian doctor, or Kenyan doctor, for example, and you graduated more than 4 years before applying for residency, 98% of schools will not take you. Okay, even though you're qualified, because the rule says if you've been more than 5 years out of med school, you can't come in. Something as simple as that. And so we have qualified surgeons, OBGYN doctors, pediatricians who are, fellows in UK and in several areas who are standing on the sideline, not able to participate in the American dream just because the system won't let them in. And I can go on and on. So I have a different story, but I'll share those at all the time. Thank you.
Thank you. I do want to ask Dr. Waters, you're our CMO for Dignity Health.
Mhm.
You work with Common Spirit Health. How can we have Black residents, we have Black medical students. How do we recruit them into our physicians to be part of our system? Is there any strategies or how can we all work together to do that when they come into our healthcare system, to keep them in our healthcare system?
Oh, thank you, Renuka. I think it's an absolutely critical question, and there isn't a specific strategy. I think what has happened is, and the reason why I came to Common Spirit is we had a Black CEO of the entire company, and that was I didn't know any company of the size of that we were as at the time Dignity Health to have a Black leader, and so that drew me. And I think as we get more, and that's why I'm doing many of these seminars, as we get more known, this one strategy, people will see, hey, must be a good place to work. That's one. Two is our leaders from addressing any unconscious bias in terms of when you get applicants, at least when we're looking for qualified physicians, our retention and our talent agent recruitment departments really need to be more proactive in looking for or working with talent recruiters that have a niche in Black physicians or community of color physicians, so that in the pool of applicants for a given position, be it academic or be it clinical, there's a wider pool and more consideration. Now, we're not talking about quotas. Those are gone, but we're talking about giving access and opportunity. And that's been the biggest difference for Common Spirit, me being the first Black chief medical officer in the history of St. Joe's, and Gabrielle Hanley as being the first Black CEO in the history. Those are the kind of things that make it noteworthy to begin to attract more people. But there needs to be more work. And to your point, it needs to be a specific strategy. And I think that's going to be worked out through our affiliation with Morehouse. Our affiliate, we have a $100 million grant working on education, developing programs, connecting Morehouse, even with Creighton. I'm part of the Dignity Common Spirit Diversity Inclusion, having strategies to make sure that we push that forward. Right now, we're looking at just addressing cleaning our own house out and making sure that we have good data and acting in a way to formalize better healthcare for our patients. That's been like the first step. But thank you for that question.
Thank you.
Yeah, I think my swing on that real quick would be, there's a famous saying that diversity is a fact, inclusion is an act. We got to include African Americans in everything we do across not only St. Joe's, but across the board. That's why I give that intro for taking the lead in doing this. When I sat on the board for St. Joe's for 10 years, every year when we finished residency and talked about how great it had been, my question has always been, can you please break this down by maybe races? Can you tell me the representation? And I think we've gotten better. But Vic, you can look into that as well to see. We really have to be intentional about it. We can talk about it until we go blue in the face.
Exactly.
But we really have to say, okay, our goal the next 5 years is to have X amount of African Americans in our program and go after it, and sort of ignore the chatter and say we're going to take the lead on it, and we're not going to talk about it anymore. We're just going to make it happen, and that's possible.
Thank you, Dr. Egbo. And one thing that we can do also, we have Black residents currently in our programs. I think we have to intentionally recruit them from the beginning when they get into our programs and keep them in our system. We have some work to do there. Dr. Townley, I see your hand up. Do you have a question?
I do. Thank you for a great presentation, great stories, and great questions so far. One thing that concerns me is our testing system. I'm very concerned that our testing system is racist. And that not just to get into med school, but to stay in med school, to stay in residency. And just wondering if you could comment on that. I think it excludes quite a few people and prevents them from continuing as well.
Well, yeah, no, you're right. You're right. I mean, it starts with SAT scores, right? And the MCATs, et cetera. Number one, there isn't enough support to help guide the student to perform better. I grew up in that day. Even when I went to law school, just for example, there were some law schools that said we won't account for your LSATs, similar to MCATs, but we'll account for who you are as a person and your qualifications as a person overall versus the score. And knowing that there are people that just won't perform the same scoring levels. And I don't think that's happened as much in medical education, that they still use that as the bar to where you go to Harvard, where you go to whatever level school. And that's a huge disadvantage to students who have every capability of, once they get in, doing fine. And so I'm just affirming what you're saying. I don't have a solution, except I wish there would be broader opportunities to discount or way less the scores, but you by all means are correct. Dr. Egbo, I don't know anything. I'm not as current in the testing pieces many people are, but that's, my 2 cents from it.
Yeah, thanks, Vic. You did a good job of it. Bottom line is, in the academia world, some of you are on this call. As you know, I believe is it a step 1 or 2 score? They're moving in the direction for those who are students into just a pass or fail. I think that will be a game changer. And then we can start looking at these other factors, like Dr. Waters pointed out, that really make, outstanding, residents and students. The picture I put out about my kids, I did that intentionally, and I think you all got the message. You can tell kids, they can play sports all they want. My kids play at the highest level, but there's none of them that's come back home with less than 4.0 GPA. And so that's great. But also I know that when my kids apply for med school and are applying for dental school as we speak, they don't have a chance. That's not, something I could talk about on this call today, but the idea about eliminating a group that's already disenfranchised in many ways is unconscionable. There's got to be ways to say, gosh, if you did this and you got to this point, there's something about you, which is how I got residency, by the way. It was actually a white brother who said, did we invite you for an interview? I said, no. My wife, I tag teamed with my wife to go for an interview. And you know what? He looked me in the eye and said, Dr. Egbo, I don't know about anybody else in this program, but you're the candidate I'm looking for. I cried and I'm like, whoa, this is crazy. Somebody wants me, somebody sees me, somebody knows I can do this. Needless to say, I'm here today. So yeah, you're so right. Those scores should not eliminate potential docs. Thank you.
Renuga, I know we're at the top of the hour. I just want to give everybody my cell phone. My commitment is those remaining on the call, and we got plenty, that they can reach out to me. My commitment is to be available. And that's made the difference in my life when people made themselves available. So thank you, Renuga. Thank you.
Thank you so much. I would love to continue this discussion. So I would love to invite you all back for future discussions, because there's so many questions in the chat and people
Sure is.
we want to continue this because this is so important. I'm going to give it back to Dr. Johnson. Would you like to say last few words, Dr. Johnson?
Just a thank you to Dr. Egbo and Dr. Waters for the contributions that they made today. They're significant. Vic, you're great. You know that, man. I love you, man.
I love you too, man.
So we're just going to close it here. Thank all of you for your attendance. And if you have questions or additional follow-up with respect to CEs, you can talk to Dr. Seaman about that. Thank you very much.
Thank you, man. Thank you. Bye-bye.
Yeah,